Hello, my name is Dr. Sultz, and I'm a pediatrician in Texas. And today I want to talk to you about the top 5 ways this new CDC vaccination schedule is going to affect your family in the next year. I think this is bringing in some really big changes, some of which are good and some of which are maybe not so good. And I tend to be a moderate in most things, so I don't like to take sides or talk to the extremes, but I want to be a voice of reason that's research based and can help you figure out how to navigate this new schedule. So, just a couple of things first is that I think that they are trying to align our country with other countries' standards. They are also trying to build trust for the American people, because there has been a trend of decreasing vaccination rates in the last few years since there has been a lot of confusion with the COVID vaccine. I also think that this was a bit rushed because it was a month ago that President Trump asked them to create a modified schedule, and to do that through the holidays without any input from the large vaccination organizations in our country is a little concerning as well. So the first reason I think that this is going to affect your family is that there's going to be more discussions about vaccines. It's going to be on social media. It's going to be in the doctor's office, in the house, and with friends and family. And so being educated on where you stand can help you to feel a lot more confident as you navigate those conversations. Number 2 is the vaccine schedule is complex. A lot of these diseases vary in how sick it can make you, and the vaccines vary in how effective they may be or in the risk for side effects. And so I think that it's important to learn that, but there are a lot of diseases. Originally, there were 18 that were on the mandatory schedule before this new schedule, and now there's 11 that they're saying are mandatory for all, and the others would still be covered by insurance if people want to continue to receive them, but that they may be just for more high-risk groups with certain medical conditions, or for those who are in certain situations have certain risk factors. So things like the rotavirus vaccine, if you go to daycare, there's a higher risk of being exposed to that. So that being a factor that you would discuss with your doctor and decide if you want that vaccine or not. I think it's important to remember that we often like to believe that all of these vaccines are 100% effective and 100% safe, and unfortunately that's just not the case. There is variability, and that we do have data to support a lot of that information on how frequent do we see this disease, and it may be a lot less than it used to because a lot of these diseases now are rare thanks to vaccines, and a lot of the side effects from the vaccines are rare. So it can be a difficult decision to determine which of those risks are you most concerned about. So number 3 is that this will mean fewer shots for a newborn. So going from this broad schedule, I have given all of these vaccines personally. I have had lots of discussions with families. I have helped parents create alternate schedules because I was dealing with a population that had a lot of questions and weren't sure that they felt comfortable or that they needed or would be exposed to all of these illnesses. And I've been able to safely navigate that with a lot of families. And so I hope to continue to do that on a broader scale with a bigger population. I think number 4 is that this is a sign more than ever that you need to get educated about vaccines. That's why I created Educate Me MD, because I'm passionate about teaching. I'm passionate about learning. When I see things like this, I immediately start digging into the articles and the data and saying, why did they make this decision? Where did they get this information from? And so that is what I want to share with you, and hope that you will continue to follow me and learn with me on this journey. Number 5 on my list is that you and your family have rights. You have a right to say, I want this for my family, or I don't want this for my family. But I hope that that decision is not just being made out of fear or out of an opinion from a friend, but out of true knowledge of what you are most concerned about for your family, for your background. Maybe you had personal vaccine reactions or have a higher risk due to conditions that you have that you may have passed down to your kids. Maybe you have a family that stays mostly home and together and doesn't travel a lot and doesn't go to daycare or a lot of different places with a lot of different groups, and your risk may be lower for certain conditions. So with all of that, I think that in conclusion, it's more important than ever to just know your rights, know the schedule, know what you want, and to do some of that research, to not just trust that what's being told is best for your individual situation. I think with like most things in medicine, that this should be customized to the particular individual. So I think one way you could do that is to make sure that you know your plan. So this is going to be overwhelming for a lot of pediatricians' offices because this is a big change and they're not set up to handle different schedules for different kids. And so if you have your own blank immunization record, and I'll post one below that comes from the Texas Department of Health that you can use so that your baby doesn't get an extra dose that maybe they weren't supposed to get and doesn't miss any doses that you wanted them to get. And if you track that yourself and bring that with you to each visit, then that can help to align with your pediatrician to make sure that your child is on track. I hope that this was helpful. If it was, please like and subscribe to my channel so you can see more videos like this. I hope that you have a wonderful day. Thank you.